about HIV and AIDS. In July 1981, an outbreak of a rare form of skin cancer known as Kaposi sarcoma was reported. At the same time, doctors began seeing unusual infections among otherwise healthy individuals. About a year later, the CDC labeled the disease Acquired Immune Deficiency Syndrome, or AIDS, which is a disease in which the immune system of a patient is weakened. That year, more than 1,600 cases were reported and almost 700 deaths resulted from the newly identified disease. In 1983, the human immune deficiency virus, or HIV, a virus that attacks the immune system, was confirmed as the cause. In 2000, AIDS was the fifth leading cause of death among adults from 25 to 44 years of age. So let's talk about teens at risk. In the United States, the overall rate of new cases of HIV infection has fallen slightly since 1985, and new drug therapies help AIDS patients live longer. As a result, some people have a false sense that AIDS is no longer the problem it once was. However, data indicates that although new AIDS cases are declining among the population as a whole, there has been no decline in the number of diagnosed HIV infections among youth from 13 to 24 years old. In fact, teens have one of the fastest growing rates of HIV infection. Many young adults who are currently dying from AIDS were infected in their teens. Infection with HIV can be prevented. Teens who choose abstinence from sexual activity and from injecting drugs greatly reduce their risk of HIV infection. Making responsible decisions about personal behaviors is the most valuable tool you can use to protect against HIV infection. So let's talk about HIV in the body. You may recall that lymphocytes are white blood cells that help your body fight pathogens. Your body contains billions of lymphocytes, which are produced in bone marrow and found in the blood, lymph nodes, appendix, tonsils, and adenoids. When HIV enters the blood, it invades certain cells of the immune system, including T cells, which help other lymphocytes identify and destroy pathogens. The viruses take over the cells and cause them to produce new copies of themselves. The newly produced viruses break out of the cells, destroying them. The new viruses infect other cells, and then the process repeats itself. As the number of viruses increases and the number of T cells decreases, the immune system becomes less capable of preventing infections and cancer. The body becomes susceptible to common infections and opportunistic infections that occur in individuals who do not have a healthy immune system. These infections are difficult to treat. With a weakened immune system, the infected individual suffers one illness after another. HIV infection is progressive. That is, it destroys the cells of the immune system over many months or years. Being infected with HIV does not necessarily mean that an individual has AIDS. AIDS is the advanced stages of HIV infection. So, how is HIV transmitted? The HIV organism lives inside cells and body fluids. However, it doesn't survive well in the air or on surfaces such as toilet seats or telephones. It cannot be transmitted through food. A person is not at risk of HIV infection by working next to or being in the same classroom as a person who is infected, nor by merely touching an infected person. HIV can be transmitted from an infected person to an uninfected person only in certain ways through blood, semen, vaginal secretions, and breast milk. You can greatly reduce your chances of HIV infection by abstaining from sexual intercourse and avoiding the use of injection drugs. So, sexual intercourse. HIV can be transmitted during any form of sexual intercourse. During intercourse, secretions containing HIV can enter a partner's blood through tiny cuts in the body. The risks of HIV infection increase with the number of people whom with a person is or has been sexually active. Having an STD that causes sores, including chlamydia, genital herpes, gonorrhea, or syphilis, can increase risk of HIV. Sharing needles. People who inject drugs and share needles are at high risk of contracting and spreading HIV. If a person who is infected with HIV injects drugs, the needle or syringe can become contaminated with the person's blood. Anyone who uses the same needle or syringe can inject HIV directly into his or her bloodstream. Injections under the skin or in muscle also have spread HIV. Then mother to baby. A pregnant female who is infected with HIV can pass the virus to her baby. HIV in the mother's blood can be transmitted through the umbilical cord and during delivery. Because breast milk can contain HIV, a baby can receive HIV while nursing. Now let's talk about treatments and stages of HIV and AIDS. Just as many STDs show no symptoms and many infected individuals don't seek treatment. The same is especially true for HIV. Infection can be ignored or overlooked for several years, during which time the virus can still be transmitted. So, stages of HIV. The HIV infection develops in stages over the course of several years. A person is considered infectious immediately after contracting the virus. Approximately half of all persons develop symptoms about 3 to 6 weeks after becoming infected with HIV. These symptoms may include fever, rash, headache, body aches, and swollen glands. In general, these symptoms disappear within a week to a month and are often mistaken for another viral infection, such as the flu. After the flu-like symptoms disappear, the person enters an asymptomatic stage, which is a period of time during which a person infected with HIV has no symptoms. A person may show no signs of illness for 6 months to 10 years or more. However, the virus continues to grow and the infected person can still transmit the virus to others. Then there's the symptomatic stage. So during the asymptomatic stage, the immune system keeps pace with HIV infection by producing billions of new cells. Eventually, though, the number of cells in the immune system decline to the point to where other infections start to take over. This marks the symptomatic stage, which is the stage in which a person infected with HIV has symptoms as a result of the severe drop in immune cells. The symptoms may include swollen glands, weight loss, and yeast infections. And then there's AIDS. During the latter stage of HIV infection, more serious symptoms appear until the infection meets the official definition of AIDS. This includes the presence of HIV infection, a severely damaged immune system measured by a number of helper T cells, and the appearance of one or more opportunistic infections or illnesses. By the time AIDS develops, HIV has often attacked the brain cells, causing difficulty in thinking and remembering. Let's talk about detecting HIV. Individuals who think they may have been exposed to HIV should seek testing through a healthcare professional immediately. Testing to determine the presence of the virus can be done by a private physician or at a hospital, a health clinic, or a local health department. Most states have laws to protect confidentiality of test results. So there's the EIA test. The first test, usually performed in an ELISA or EIA, a test that screens for the presence of HIV antibodies in the blood. EIA reacts to even small numbers of HIV antibodies. However, the EIA may give inaccurate results. There are two reasons for this. One, developing antibodies takes time. Weeks or even months after initial infection, before antibodies develop, the EIA may give a false negative. This means the test is negative, but the person is positive. There aren't enough antibodies for the test to detect. Most infected people still test positive in 3 to 4 weeks, but some take up to 6 months to test positive. Next, certain health conditions, such as hemophilia, hepatitis, and pregnancy, can cause the EIA to give a false positive reading. This means that although the test was positive, a person actually does not have the infection. And there's the Western blot test. If the EIA test is positive, it can be repeated to make sure that the results are accurate. If the repeat test is also positive, other confirmation tests will be done. The Western blot, or WB, is the most common confirmation test for HIV in the United States. If done properly, this test is 100% accurate. If the results of all three of these tests are positive, a person is determined to have HIV. Often these individuals are referred to as HIV positive. So about impact on the availability of health services. When HIV was first identified in the early 1980s, there was no treatments for HIV and few treatments for the opportunistic infections associated with the virus. In the years since then, several medications have been developed to treat HIV and to treat and prevent the complications of opportunistic infections. More drugs and vaccines are being researched. For many people, these new treatments have extended and improved their quality of life. None of the drugs, however, cures HIV or AIDS. One reason that a cure is so hard to find is that HIV infects the very cells that regulate the immune response. In addition, several new strains of the virus have emerged since it was first discovered, making it even harder to develop an effective treatment. Many treatments have side effects so severe that some people may stop treatment or take medications only once in a while. This can lead to the development of new drug-resistant strains of the virus. Also, treatment can be costly, exceeding $1,000 a month. Worldwide, many infected individuals do not have access to treatment because of high costs and lack of availability. Now we have HIV and AIDS, a continuing problem. The number of newly diagnosed AIDS cases in the industrialized world is decreasing. Much of this decrease in AIDS cases results from the success of drug cocktails, which are combinations of drugs that slow the progression of the HIV infection. This success has brought complacency about the need for HIV prevention. However, this is a false security. Research has identified new drug-resistant strains of HIV. These strains do not respond to the drug cocktails currently used to fight and attack AIDS. The combination of drug resistance and high risk behaviors could result in HIV strains that are transmitted and spread even more widely. Despite the progress that has been made in the development of treatment options, HIV and AIDS is still a fatal disease for which there is no cure. Let's look at HIV and AIDS on the global scale. At the end of 2002, an estimated 40 million people worldwide were infected with HIV and AIDS. This statistic means that HIV is now a pandemic, a global outbreak of infectious disease. The number of people living with HIV is growing. It is estimated that in 2002 alone, 5 million people became infected with HIV or AIDS worldwide. Now let's talk about staying informed about HIV and AIDS. Because neither a cure for AIDS nor an effective HIV vaccine is available, knowledge is the first defense against infection. New research can be found in newspapers and magazines, and on television, radio, and on the internet. The CDC, state health departments, and community health services are excellent sources of information. Teachers, school counselors, and physicians can provide guidance on how to find information. By avoiding high risk behaviors and staying informed, you can protect yourself and others from infection. Now, let's talk about abstinence and HIV and AIDS. During your teen years, you may feel pressure to experiment with new behaviors such as engaging in sexual activity or using drugs. Consider that your actions today can change the entire course of your life. Choosing to remain abstinent shows that you are taking an active role in care for your own health and acting responsibly by not jeopardizing the well being of others. User refusal skills will help you avoid pressure in engaging in sexual activity and using drugs. First, we want to avoid the situation and events where drugs use and the pressure to engage in sexual activity is likely to occur. If you're at a party where things are getting out of control, leave immediately. Next, practice refusal skills. Be firm when you refuse to take part in drug use or sexual activity. Use body language as well as words to get your message across. Finally, choose your relationships carefully. Avoid forming a dating relationship with someone whom you know to be sexually active. Avoid known drug users or people who approve of drug use.